Today I'm leading you through an exercise flow to relieve low back pain in pregnancy. If you're pregnant right now and new to my channel, make sure you subscribe and click the bell button below so you don't miss any of my pelvic floor tips for an empowering birth and postpartum recovery. So we're gonna start in the standing position. You're gonna put your feet wide apart and we're gonna start with some pelvic rotations. So start clockwise, really exploring where those tensions are, and then the other direction. As always, and I'm gonna repeat this a few times throughout this session, but we wanna go in the range that feels good to us, especially when we're dealing with back pain. Like if you're coming here and it's starting to feel sore, then just go with smaller circles, right? The idea is to move within the range that feels good and comfortable. And then going into a twist. So we're gonna bring our hand to the opposite foot. Exhaling as you go down, inhaling as you go up. Those rotations are often lost in pregnancy because we move in such a linear way. And I mean, not only in pregnancy, I would say, most people, do much more linear motion or movement versus rotations. But I find that working on rotations during pregnancy can be really beneficial so we don't lose that mobility for postpartum. Now moving onto the floor, we're gonna go on all fours. The knees are hip width apart and we're gonna start with nice gentle cat-cow. So rounding the back, letting your head drop, and then opposite way. And I really want that pelvis to rotate. So picture having a pole through your hips and you want to rotate your pelvis around that pole. Great. Now we're gonna have our knees a little wider apart, so probably like your yoga mat width. And then we're gonna go and sit onto our heels and come back on all fours and do that a few times. Moving nice and slow. And as any flow where we're working on pain management, you want to listen to your body and make sure that you're going in the range that feels good to you. So maybe for some people it will be just here, they're not going to go down onto their heels, and it is okay. Just find what feels good. The idea is to move our body. Now we're going to stretch our psoas muscle, which is a muscle that flexes our hip and is located just at the front of our hip here. I like to have a little bit of a support with one hand when I do the stretch in pregnancy, just for balance. But if you don't have one, you could have a chair or the wall to support you. And if your knee is not liking that hard yoga mat, feel free to put something underneath, a little cushion or a folded blanket. And you really want to push your pelvis forward and feel that stretch here. You want to straighten your upper body. You can even look up. Breathing here. The psoas muscle, by the way, is attached to your lower back, vertebrae. So that is why with lower back issues, it can be nice to stretch that muscle to give a little extra slack so it's not pulling your back forward. And we're switching leg here, as you can see. And you want to do, at least 30 to 60 seconds to have an effective stretch. You can even do a little bit of rocking motion if that feels better versus just staying in the stretch. Our next one is going to be a deep squat stretch. Because I'm in my 3rd trimester, I like to use a prop for this. It could be a big book that you have. It doesn't need to be an actual yoga block. So I'm going to use the wall to support myself, and I'll put my bum onto the yoga block. And why I'm including this stretch in this flow is because our pelvic floor muscles are going to be stretched in this position. So you really want to picture letting go of these muscles around the vagina and anus. The pelvic floor is connected to your sacrum and your tailbone, which is basically your lower back, right? So that's why I want to address that in this flow, because we never know. People can have pelvic floor tensions and that can create back pain. So just breathing here. Need to catch my breath. Just talking feels hard sometimes. That's okay. It's a season of our lives, right? Just staying here for a minute or so. Great labor prep position as well. I love this position for labor and to just unwind tensions in the pelvic floor. Now we're going to move onto our back. So let's just lower ourselves nice and slow onto the floor, coming onto the back. And you've heard me saying this before, but if by any means you have symptoms of dizziness or nausea or being short of breath in this position, you want to avoid exercising on your back or prop yourself up. So our first exercise on our back will be a figure 4 stretch to go stretch our glute muscles. So you're going to bring that leg toward you and flexing that foot here and just pulling toward your chest until you feel that stretch here in the right glutes. You can even do a bit of motion back and forth from right to left, or even, use your hand here to go do some mini circles. Find the tension and work in it. If that's too hard for you to grab that leg, you could have a strap around your thigh as well. Again, we're holding that for a minute and then releasing, and we'll do the other side. So left foot to your right knee and then pulling that leg. I can notice a clear difference in between my left and my right. My left is so tight compared to my right. And those glutes muscles are connected to your pelvis. And when they're tight, they're just pulling the whole chain, right? They're pulling your lower back. That's why we're including this here. Our next one is going to be the windshield wipers. So you're going to bring your feet wide apart, so just at the edge of your yoga mat, and then you're just going to drop the knee in, bring it back up, and then drop the other knee in. Moving nice and slow. Paying attention to our lower back. How does that feel? Does that feel good, or does that feel like a discomfort or a pinch? If it is pinchy, we just want to reduce the movement a little bit, so go less deep into our movement, more controlled, more slow maybe. Awesome. Now you're going to bring that right foot with your left foot, so just at the left edge of your yoga mat, and then bring your butt up and just move it to that left side of your yoga mat. And now you're gonna go and drop your knees for a nice twist. You can even look to your left for even more twist in your spine. Letting those legs drop. If you wanted, you could have a prop here if that felt more appropriate and you wanted to go less deep into the stretch. That is only if you're feeling any discomfort in the lower back. Otherwise, just letting your knee drop. I just love that stretch. I could stay here forever. Awesome. Slowly bringing the legs back up, moving smartly and slowly. That's the key with back pain. You don't want to irritate it. And now we're going to move our body to the right side of our yoga mat and opposite. So dropping the knees to the left and looking right if we want to. Congratulating ourselves for doing this for our own health, for a healthy pregnancy. It's not always easy to take care of ourselves, right? And prioritize that. So when we do it, just acknowledge it. Good job, Sophie. Perfect. And then coming back. To end our session, I would like to show you the calves on a stool resting position, which is so lovely, especially in pregnancy when you're starting to feel heavy. So what you're going to do is go by your sofa. You can also bring a chair, whatever you have nearby. And then you're gonna push your bum as close as possible from the chair or sofa. You need also a pillow or a cushion that you're gonna put under your bum to just elevate your pelvis a little bit. And that reclined position is so good to relax the pelvis, the lower back. Just take some of that belly bump weight off your pelvis and just enjoy here. Nice deep breath into your baby, into your womb. Great position for improving circulation in your legs and your pelvis. We'll take a few more breaths here. And when you're ready, opening your eyes. And to get out of this position, we just want to move very slowly. So you're going to bring your feet to the edge of the sofa. Gently lift your pelvis up. Take the pillow off. Feet on the floor. Then really paying attention to moving like the log roll here. So you want to bring your shoulders and your pelvis all together, rotate to your side, and use your hands to come back up to protect your back. If your back is feeling better, hit the like button to let me know. And I also have a free prenatal book to help prepare your pelvic floor for an empowering birth experience. So grab it in the description below if you have not done so yet. Thanks for watching.